If you're thinking starting up a breast MRI program, first of all, you get my congratulations. I think this is some of the most important work that we do as radiologists. Now, there are a couple of things that you can do to make sure that the transition into breast MR imaging goes smoothly at your facility. I think it's important that you contact people who are already using your particular kind of equipment to find out what protocols they are using. The protocols vary all over the map, but find somebody who's doing good quality work and ask them for their protocols. There's no reason to reinvent the wheel. Second of all, when you understand that the dynamic data is very, very important when you're looking at the ambiguous cases. As you know, 90% of the diagnosis is probably made over the morphology, but when you're looking at ambiguous cases, that's when the kinetic data is key. So be sure that you're consistent when you're injecting the gadolinium, and make sure that you're using a very well-defined and rigid protocol for injecting the gadolinium and getting that kinetic data. And third thing, I would say, be sure you speak to your colleagues. Make sure you have a lot of interaction. We're only too happy to share information with everybody. One last thing. If you're getting started, one of the best tips that I got was to start off with patients who are being staged for breast MR and for breast cancer. And the reason why I think you should do that is because you know those patients already have a known cancer. And so it should be relatively easy for you to find those known cancers because they'll have been identified on a mammogram or an ultrasound somehow. And you can correlate that, and that's a great way to learn what breast MR images of breast cancer look like.